Hi everyone, my name is Aubriana Peace, and today I just wanted to discuss with you all a topic that I feel the more you know, the better you're able to prepare yourself. And by that I mean against sexually transmitted diseases. So let's start with the basics. Sex. I'm sure everyone here knows what it is, what you do, and what can come of it, right? Well, for most college students, the biggest concern is becoming pregnant or getting someone else pregnant before either of you have finished your studies or are ready to provide for a child. That, however, isn't all you should be concerned with, because contracting a sexually transmitted disease is also an outcome of having unprotected sex. Now, I know what you're thinking. That'll never happen to me. I'm careful. But you might want to go ahead and rethink that, because according to Elite Daily, 1 in 4 college students in America has a sexually transmitted disease. In studies conducted, 54% admitted that they did not use condoms regularly when engaging in sexual intercourse. And in fact, in a study conducted amongst female college students, 60% admitted that they would go ahead and have sex even if their partner refused to wear a condom. Now, if you know you fall into that category of people who don't always regularly use condoms, I would suggest reevaluating your decision to engage in unprotected sex. That being said, I'd like to take a moment to share some statistics about the prevalence of STDs here in America. I'm going to go ahead and point out some of the most common STDs and go ahead and give you the symptoms of them so that you can better recognize them if they do occur. And then towards the end, I'll take any questions as well as give you a list of preventative measures that you can take to best protect yourself against contracting a sexually transmitted disease. But before we begin, what is a sexually transmitted disease? Some of you may be wondering, what is the definition? And according to the medical dictionary, a STD is any of 20 different infections you can contract that are transmitted through semen, blood, or any other bodily fluids through sexual contact with people with STDs. Now, I have included a couple of STDs in here that can be contracted asexually, and I will definitely go ahead and point those out when we get to those. For those of you who go ahead and engage in unprotected sex because you feel as though, contracting an STD isn't likely, I want to just go ahead and give you some statistics, just so you might want to rethink that it's not common at all, okay? The Center for Disease Control has estimated that there's about 19.2 million new cases of STDs here in America each year, and of those cases, over half are from people between the age group of 15 and 24, and that's the age group that a majority of college students fall in. So I know for you guys that might be surprising, but over half of people your age do contract STDs each and every year. Furthermore, 1 out of every 2 people will contract an STD before they reach the age of 25. So half of America's youth prior to reaching 25 will contract a sexually transmitted disease. Now that we know what an STD is and we have a little better of an idea of the statistics and how common they actually are, let's discuss more about what are the most common STDs that people get. So here in America, the most common are going to be chlamydia, gonorrhea, syphilis, and then HIV and AIDS. Now, chlamydia actually is the most frequently reported bacterial infection here in America. And some of the most common symptoms are going to be fever and apparent weight loss for no reason, swollen glands, fatigue, vaginal discharge. It's got like a grayish color both from the vagina or the penis depending on if you're male or female. It also may result in a sore abdominal region for women, and for men, the testicles might get swollen. So just go ahead and be aware of that. This is a curable STD. Go to your doctor. They can prescribe you things to cure this one. So just know if you contract chlamydia at any point, it can be cured. Gonorrhea is going to be the next one, and gonorrhea actually can spread to different areas of the body, unlikely places, so it doesn't just stay in the region of contact, so not just the genitalia and things like that. It can spread to other areas, other extremities like your arms and legs and things like that. Typically, it takes about 5 to 7 days to see symptoms for gonorrhea, but it can take up to about 30 days to notice any symptoms. If you contract gonorrhea of the throat from having oral sex, you're going to have a sore throat or a red throat, and then you might have white spots inside your mouth. And then if you contract anal gonorrhea from having anal sex, then you might notice some bleeding or pus in your stool. Now, just for gonorrhea and the genitals for women, it's going to go ahead and be white and yellow discharge. You might also have some itching, kind of not common, but you might get a fever and nausea. For men, it's some of the same. You're going to find yellow or white discharge from the penis, frequent urination, burning when urinating, things like that. For syphilis is the next one. It actually comes in 4 different stages, and this one can be deadly. Like gonorrhea and chlamydia, syphilis is curable, but you definitely want to catch it early. The earlier you catch it, the more likely you are to not have as many side effects from it. Now, in stage 1, it usually occurs about 10 to 90 days after the initial contact, and then you're going to get a sore where you initially are contacted, so the genitalia or maybe on the mouth, things like that. And the sore usually lasts about 3 to 6 weeks, and then it'll kind of just heal on its own. When you hit stage 2, you're going to get like a copper rash all over your body. Typically, it does spread everywhere. You'll get a loss of appetite, headaches, fevers, things like that. You might get spots on your scalp as well. In stage 3 of syphilis, it looks like all your symptoms have disappeared, so you'll appear to be cured, but that's just because the bacteria is now infecting you internally, so it's attacking your organs such as your brain and your heart and things like that. And then once you get to stage 4 of syphilis, it's extremely dangerous. It could happen 10, 20, 30 years after contracting the disease, and one day you might just get a sudden heart attack, or you might have failure of vision or a loss of your motor skills or mental functions. Syphilis has been said to attack the brain and make it like Swiss cheese, so that's really something that you should be aware of. This disease is something that you definitely want to catch early to protect yourself against all these lasting effects. HIV and AIDS is going to be the last one I talk about, and this is the one that can be contracted asexually, so I definitely want to go ahead and point that out, that HIV and AIDS can be contracted through sexual contact. It can be contracted through drug use using dirty needles, like the transfer of blood, as well as through blood transfusions and through organ donation. So if you get an organ transplant, you could contract AIDS that way. And this is the most misunderstood, so I definitely want to take the time to say you cannot get AIDS or HIV through saliva or just touching someone. You can't contract it through that. So I just wanted to make you all aware of that. Now, as far as symptoms are concerned with AIDS and HIV, most people don't see symptoms, and when they do, they just say it's like the worst flu they've ever had. So for this one, if you do get symptoms, a really bad flu symptoms that last over a long period of time, you definitely want to go to your doctor and get checked. Now, that being said, now that you know all about the symptoms and you're aware of those in case you do contract an STD, you should also know that there are some ways to prevent these from occurring, and the most common is just practicing safe sex. So go ahead and use a condom when having intercourse, oral, vaginal, anal, anything like that. Wear a condom, can protect you from STDs. Birth control won't do it for you, so any condoms can protect you from all of these STDs. If you limit your number of sexual partners, this would greatly diminish your odds of catching an STD, as well as practicing mutually monogamous relationships. That would help in, fighting off STDs. And then visiting your doctor regularly to be checked for an STD, just in case, that's the best way to do it, just so if you have contracted one, they can catch it early and then you can be treated for it if it is a treatable disease. And then, of course, you always have the option to be abstinent. I know in college that might sound like it's impossible, but some people do it, and it is the most effective way of not contracting an STD, okay? So now that you know the prevalence of STDs among American college students, you know the most common types and their symptoms, and you know how to prevent them, the decision is all yours, whether you choose to take the risks to further have unprotected sex or not. But thank you all. If you have any questions, just let me know, and I hope you choose wisely.